Hello, everyone. My name is Anchieta Belli, and along with my fellow health associates, CD and Hanif, we supported the Compreva team who seek to support hidradenitis suppurativa patients, or HS. These patients have limited options, but we know that Compreva is an actionable solution to the open wounds that HS causes. As a team still in the prototype stage, we helped support them and worked with the mentors, our amazing mentors, Russell Brown, Lego Gopal Krishnan, and Michelle French, on market validation, prototype development, and path to market. Thus, we worked to bridge the gap between feedback and implementation, focusing goals on a viable product. Later, we provided our own input and feedback into the pitch itself. We have seen the development of the solution, and through this process, we learn different things such as the different routes to market, market validation, and market research as a whole. We have even learned and provided ideas in prototype design. We have seen the development of the solution and are grateful to support unique innovation in the field of dermatology. I'd love to now pass it over to Nuha to share more about the impactful solution of Compreva.
Great. Good afternoon, everybody. I'm excited to share Compreva on behalf of my team. Imagine hiding a painful skin condition from your spouse for 2 years, sleeping with towels every night to soak up the constant drainage, taking out the trash in the middle of the night to hide the odor. One of our patients with hidradenitis suppurativa felt like they had to do just that. HS is a chronic skin condition marked by painful lumps and abscesses, but the hardest part is the relentless, unpredictable drainage from these open wounds. Thick, foul-smelling fluid can seep into clothes, bedding, and dressings, disrupting daily life. Many patients have to give clothes that they love and pieces of their identity. HS affects 1 in 100 people, yet current options remain limited. Cheap gauze and tape can further irritate the skin. On the other hand, specialized garments like HydroWear can cost over $1,000 a month, even with insurance. And that's why Compreva, we plan to bridge this gap. This is a heat map highlighting where our symptoms are most severe, areas that are prone to friction and drainage and dressing challenges. We're engineering, and that our first product is a discreet, affordable garment targeting under the arm and under the breast. We're engineering a custom fabric blend to help minimize odor, secure dressings, and manage drainage. We have gone through 4 design iterations based on feedback from patients and HS specialists. The dermatologists we polled, 100% of them said that they would recommend a product like ours to their patients. And we're not stopping here. We plan to scale our product to different areas of HS and apply this new technology in other markets like wound care and sports injuries. We're a team of 5 health designers trained at UT with diverse backgrounds from medicine to engineering and interior design. Dr. Pena, our CEO, is a dermatologist who specializes in HS. And we've co-designed every step with patients to ensure that our product truly meets their needs. We've addressed expert feedback based on with the guidance of our mentors. First, market validation. Our customers are all HS patients, and we're starting with plus-size women, which accounts for 75% of the population, with plans to scale to all 3.3 million with a system of products. We'll launch a DTC for affordability while exploring partnerships with wound care companies to bundle compatible dressings. We're working with the UT's Discovery to Impact and filing our provisional patent. And lastly, most HS patients aren't aware that a garment solution exists. And that's where we're building a patient-facing brand by running usability studies, leveraging social media and clinic partnerships to drive early engagement. We're currently in phase 1, where we plan to use this grant to continue our research in developing and finalizing our tech pack and fabric development. In the next phase, we'll manufacture our MVP and conduct usability studies, as well as scale our designs. And the last phase, we'll launch our $60 over-the-counter garment and expand assortments into higher price points that are still attainable. For those living with HS, Compreva offers relief, confidence, and a better quality of life. Join us in making that future real.
Thank you, Nuha.
Didn't want that uncomfortable silence. No, great job. So I heard you say something really important about the potential to expand the usability of it to other areas beyond HS. So I don't want to divert attention from HS, but can you expand on that a little bit?
Yeah, and so our product has this kind of unique ability in terms of it's basically holding dressings in place and then making sure that it's not irritating the skin but still has the compression aspect. And essentially, we can use this in other markets instead of just a dressing. We can use maybe an ice pack or a heat pack and be able to hold it in place in like very difficult anatomical areas like under the arm, given like the concavity of it. We're able to still address those needs with the same product.
I just wanted to know about the garment, a little bit more information about that. It's a great presentation, and I like the fact that it's really focused on doing something for patients who've been suffering with this way. Is the garment reusable? Is it washable? Is it antimicrobial? Does it last a long time?
Yeah, and so that is a really big point because affordability and sustainability is it's what we've learned from patient interviews and one of their needs. And so as we're engineering our fabric blend, we do plan to make it sustainable and reusable. And as well as the antimicrobial aspects, we're exploring fabrics that have those properties and that can also minimize odor in that both ways. So be able to target patients' needs in multiple areas.
So tell me more about the awareness campaign. So if this is something that folks are maybe a little bit embarrassed about, and we all know that healthcare and doctors love change, how do you get folks aware of this to actually use this?
Yeah, that is such an important part because of the shame aspect. So there are campaigns and patient advocacy groups. The National HS Conference is one thing, the National HS Foundation, where they have a conference every year to help support these patients and bringing awareness about that. Our wonderful PI and CEO, Dr. Pena, has a great relationship with her patients, and through that, we've been able to interview them and really understand their needs, and it has built a very strong relationship already through that, which we hope to expand beyond.
Thank you. Great presentation.
Thank you.